Let's talk about forefoot pain. In other words, pain usually on the ball of the foot. This is a very, very common thing for people to have, and in most cases it just goes away on its own with some rest, perhaps better shoe wear and not standing in bare feet. If it doesn't go away, then I'd be very happy to see you and try to work out exactly what's happening with your foot. There's various different causes of forefoot pain. Most commonly diagnosed in primary care would be something called a Morton's neuroma, which is where the nerve between the third and fourth toes gets rubbed, scars, and forms a painful cluster of nerve cells and scar tissue. The most common thing that I see is actually metatarsalgia, which is a clever way of saying pain in the metatarsal heads, and the metatarsal heads themselves are what form the ball of your foot. That tends to come from an overload. So the overload can be due to a problem with the rest of the foot, a problem with overall body weight, or a problem with putting too much pressure through that area. The first thing we'd always do is diagnose you with examination and usually a weight-bearing x-ray of the foot. We'd then move on to an insole which offloads the area. If you wish, you buy those yourself online. Essentially, it's a small shelf just behind the ball of the foot to take more weight through the other part of the foot rather than the ball itself. If this doesn't work, there's various other things that I can do for you, such as injections if the joints themselves are inflamed, or sometimes shortening the bones off to decrease the pressure in those areas. That would of course be a last resort. Pain in the foot's often worse with people who have a bunion because they take more weight through the second metatarsal rather than the big toe metatarsal. Again, something that we can deal with if you come to see me.